We on okay, I'll say OB. On Saturday, October 17, 2017, same gas explosion occurred at Atomic Junction in Accra, which killed 7 people and injured 132 others. Lack of negligence on the part of the driver, the loading station and gas station, which is the offloading station, Gaiji and Odiwe Abre. Gaiji yedase papa. Ma we say Obi. To my first fruit, Nancy Achie Martinson. Happy birthday to you. Growth, grace, and Godspeed is what we wish for you. From your parents and siblings, home and abroad, we say live to be 94.7 and beyond. Hashtag Ekosiisen. And it's from your dad, Alex Martinson, and Odiwe Abainte. Nancy Achie Martinson. Happy birthday to you. Mamema, the administrator of the Ghana Medical Trust Fund, Akwaba, Obobia Darko-Opoku. Obi Akwaba, net saying.
Boko Obi Michelle ni utie fonya.
Bibi Akoye.
Mejani anche ndedi ya mabetna.
Ene wa madia.
Bibia boko.
Wa madia
nkamba. Mia nkamba hu wa secretary to.
Yeah, danyamia se. Inti edikan, I mean, ma yeva yenim say Ghana Medical Trust Fund. Omampenyi eshe hobo ewo ni manifesto auton edema Ghana for no emu. Bobe busa say, what is the urgent need for fund be say? They are the intia ni here see benya fund way.
Obi sabe say health insurance na koso a check akra.
Sure.
And I enim near health insurance to me.
Yes.
Nti omampenyi adwen hu say health insurance na ewo baby a ende wo ho a ya yede to aso enene den. Because at the end of the day, when you breast cancer, health insurance treats you to a certain point. In your money bill, it doesn't cover. Until at the end of the day, no, pro nya NHIS bit me provide the amount and kind of anything. What's my say? Until and I may say that decision to bring the Ghana Medical Trust Fund into fruition is a very bold decision. And when you be so or drink crowd wisdom about nipa ahunyinyane nipa hunyemaya on to me drink who say baby a national health insurance end no I say baby what why etwaso into yen you can say where the national health insurance ends we begin. What am I saying? Because chronic diseases no be na say we follow ayina we must say and why am we take akra your chroma and the 45% of deaths is attributed to non-communicable disease. 45%. 45%. You check here stroke, diabetes, kidney failure, liver cancers, all of them. We check here statistics now. 45%. Inti sabi ultimate na honye hwe han say my national health insurance in teacher say we na say intimi ambo anwa. I think that is a very bold decision. And on my opinion, they were taking a decision or sign the ejuma na hye yensa. Inti nsanya yen be ye no and no be manage na. Inti dey bia make say yen pay sitters. Ye see foundation. Foundation so ye tonyebo. Na ye see ni ye because ye see ni ye bibia ebesibia the Ghana Medical Trust Fund will stand. What am I saying?
And our first administrator of the fund. Okay. Inti uteki over no. Now the only thing I want to run our parliament up.
Enemy green letter.
I'm running the green letter now. In the so far, Nioma Ben wait me go
I'm happy to announce to say Yenya up and running secretariat.
Okay.
And I need kinds of Dr. Victor Bampasi, National Health Insurance. Or Yenipa.
Yes.
Sebi yes, that secretariat nanka say many cratch be one na kasada nobet.
Oh yeah.
Ono yempe na neo. Doctor says that be National Health Insurance way ni ayeye wahi it's similar to ni awo ba be. It is hardly a second day my staff ni biama. No krani ye ni so tete na was sending about 15 of his staff.
Oh really?
Yes. Inti omuna yeni omu started, and I must say, let me commend them. They really have done well. And yeah, easy starting something from the scratch, and the pressures and workload. You see that nobody is complaining. Everybody wants to see it succeed. Into uba ya yesi nuanumu. Eba na najua yebet na ho. Eba nse yebe so candle na yetinem. Eba nse yebe tuegu abonti ya yenya sisa yehu na yeko na yeba. Nti obi an complaini se bi ama brana. Nti medi ye meka ne se no na ama sisi ya yehu ni ya yehu. Nti ode ne staff ne ba ye no na ye ni omu start ye nyame adom and the yenya board of trustees ye lawyer Tony Later ye board chair nti at the end of the day only 12 other members almost steer the affairs of the trust fund. Yes, please. And now was when you say act you're passing act 1144 and basically what we're doing is mobilizing resources to finance the specialized care for chronic diseases we mobilize this asikana ubeda na at the end of the day national health insurance obema in 20% of ne BBL within a year.
Within the year, 20%
okay. But I don't want me yes age one. And now, Bibi Kakrasu or what met you Adrian Basu. Sabi, Yakase Ghana Medical Trust Fund. And Crawford people who Madrian say, Abayama Sikasi Yentia for medical bills and Kwan to be Yaria, your fra phone, your fra Ghana Medical Trust Fund. I need Tia Kadabi. Okay, Yenesa and ye. Ultimately, 4 core mandates. Mandate a 4. First one is about paying the medical bills of the persons living with the non-communicable diseases. Secondly, also infrastructure and equipment. Infrastructure and equipment that comes in because on them say NCDs want to mean for one sapine in treaty. And the Uber now see the bills right now with here. Dr. Bekacho say CT scan na me say bibi woma ebema me hu ne ntia de bia utia wo ya and they say be ye see mu no ya kotna ho keke ye set up secretariat wi an ye see mu say ye see abontin ye call tertiary hospitals na ye ne omo be ye adwuma na ye ku hwe say adwuma no ye ne sen a na be ye yi na mo so den na mo wo a mo betime di abo adwuma na ye ba be ye no. Until we went out there asking questions and getting answers, and we came back with the gaps in your data of the persons living with the non-communicable diseases. You sign your data of equipment gap. You sign your data on infrastructure. Any some of the facilities you mean for some of the equipment in Siho. Inti ebuaye inti ye this assessment to na ye ko ye no. Esisi I no ne Bible a ye di ejuma. Because loopholes ni nyawo inti ano no boaye inti ano no na ye baaye na ye hu say no ye be start from her na ye di akwa inti ano na boaye ma ye baaye ye hu say Greater Accra Rich Hospital enye Kolebu yani makakra eno de say yetumi ye boa mo but Rich Hospital there is down to ground zero. Inti no problem ho ye call confanochia ye nim say omo CT scan enye adwuma ye nim say bia omo wo MRI
teaching hospital.
Thank you very much. And the teaching hospitals no so ye wo 5 and the teaching hospital nankasa so we need certain equipment ye ntimi qualify wo say wo ye teaching hospital inti ninya no ye fire na ye share and I'm telling you say it opened our eyes to the reality on the ground inti after needs assessment and then you start to say meetings with the medical directors ye from munya bankran e betnasi ne omo twetwe nkomo say equipment ye anyway say see as yetimi boa yenya corporate institutions yenya funds yenya all these aids nya de na e ba ne yeto medical equipment ba it won't be the normal thing they bia yeto medical equipment about 5 years 10 years I say that be no under us no equipment be about what you need the
okay.
You need time and the service in time also. You need time and the turnaround time also. Into bibia ye be ye no. We are planning towards say the end of life aba ye be sano. You need say we on the 16th of February the service in time also. Your engineers that they are moving in going to check.
Okay.
Into what hospital we are not putting that burden on you. So far as this equipment is branded Ghana Medical Trust Fund, no, the maintenance ne because ye jama wa we load now wo ho no any adaje na wo. Thank you very much. It cannot be the order of the day. Into ministry ne decide say omo be set up SPV.
Okay.
Onu ne juma ya ne say
obe manage.
Thank you very much.
Okay,
and it's good because yeah no ye feel this and no be my equipment in long life and na bibia so sia omo a ye mo ye di ejuma no be mo no ye nim say pathway within 48 hours 24 hours ye fly ya na say bi wa ha omo be kwa fix ya man nti ye ni omo be sign sa agreement ni nya nti now no that load will be off the hospitals so far as that equipment no is from the Ghana Medical Trust Fund.
But that's really cool. What it then means, as part of my mandate in the act, apart from say tria medical bills for non-communicable diseases, mobile science provide equipment and infrastructure. And then after that, no more
you got training of the specialist. Sebi yakika NCDs and you be a keke doctor be a keke. No, sorry, I'll be to me here. Oncologist for or more specialized cases and we are specialists or more in those fields now on betimi ade address our patients enya no nko usa here specialist nurses thank you very much usa even here health workers almost so specialized some cases we ba ombede so into omo sure act when omo drink which papa and not mudi shame until we take care of the training of the specialists. Yes,
and more quota be for every year.
Every year, yeah, budget ye be at war. Ye training of these healthcare professionals. And last week in South Kakra, ye call nurses and midwives or omo college or ye call pharmacists for no so ye need physicians and surgeons who are signing agreement HBI ye debeto abonti into omo training specialist nurses ne mayeno sorry doctors ne mayeno ne yenim say nurses and midwifery college no so thank you very much into yamo munya quota so we be training 100 specialists of nurses and midwives no you be training 100 for pharmacists no you be say 100 for the physicians
and also fully paid by the fund
and now munya so omo courses no normally in so open full specialization it's 3 years. What am I saying?
Okay.
His Excellency Nadrian say, and baby do within a year or two for the Ghana Medical Trust Fund. Now, region Bia can boast of specialists.
And away, so no, I know, so maybe they will be bonded, said the into all those things. No, last week he called Ekoshia heads of colleges. No, you know more about come on. Ya tete committee in Kakra. Oh, mono betray. Senya ye be ya ye beti me enrollee sankrofo winya. Hospitals na ye know more ye jumano. I.e. the regional hospitals 10 no, any teaching hospitals 5 no. Omo no mo these are doctors, ne nurses, ne pharmacists no. Ebeba. Okay.
Na ya enrollee on. Inti nye me na me kotina me office na maka se me the way dabi thank you very much and na near ye so ne say enyo omo nko an ye be you see omo teaching hospitals ne regional hospitals last week ye ne private hospitals ne bi an Ekosiisen once no I meeting because ye the case be Kolebu mema example of mid nurse na sama cover obiati Kolebu could not do it because Kolebu's card lab na esi hono eja to mu nti enye juma but Urake has a card lab nti Kolebu for near 5 been say mami we ye transfer nko Urake and I'm telling you let me give credit to Urake a case ni do omo medical director fantastic guy within 3 days no mo ye kutua ye 3 days no mo dey mami no ko card lab doctor sa ko dey any team omo where you see characterization lab e dia blood clot no what ya for coffee Or train resume juma. And it happened within the space of 3 days. What am I saying? It is equipment until say you been busy regional hospitals, teaching hospitals. No, we have to rely on the private hospitals. It is any UGMC, Bank Hospital, Snate Hospital, Urake. You know, private ones, yes, okay. And I catch on say, you know, some mobile was sort of. Yeah. But if you want to work with us as a medical trust fund, you have to agree. Now about within baby you range you bet me to and I'm telling you it was a fantastic meeting because they were happy. Omo say within the short ejuma na ya no omo de omo boy ejuma no ebekoso yi, and they told us say yen set up small committee yen share omo figures no yen so yen fa ye de embra yen middle ground na yen hu na ebetimi aboy. Until that one is also one that is also in the pipeline. Until say yen be 6 wa crack. Sisi ano me team no certainly nobet omo abontin chagfo omo hospitals ni bia
Christian Health Association
omo hospitals ni bia ye betimi UC aka ye ho
abe o se mo ko search
mo ko hwe omo wone ni omo wo nti omo esimu a sisi omo nam omo cross ya koti nti by the time omo be wie no omo hwe 6 facilities aka ho. In all no we roll out to SAR 21 no near the 6 private ones no abekam then the say you roll out you confident to say we are fire we be fire what I say and on ye di
what it then means they say sebase equipment na mo be toama hospitals na and no for just public hospitals.
Public and okay. Any your friend is saying regional teaching for yes. Because private fund most of them are fully equipped. Who are you okay? I said where you are hotel. What am I say? Oko Bank Hospital are fully equipped. Into a people what they don't have a problem. I must say equipment need be they don't use it. What am I saying? Until when we decide to push cases to them now, ebe more use because at the end of the day, some cases encore and tanko.
Yes.
What am I saying? Your first case I say, Maritime Hospital, deep-seated brain tumor of a young man. And medical doctor Siansi, he did a fantastic job. Why yes surgery maybe. What am I say? But say, maybe some bank in say specialists be crashing or I think that is opening our eyes to the kind of your friends, the human resource no so yeah, chance I you be training
for clarity's sake, no be so at least we bomb more than the Ghana Medical Trust Fund. Here say or mine never see BBC. I'll come back to it because my or more can say, oh, na say NHIS or hot there. Na say NHIS 20% of music and Bema Modiadina, Yema NHIS and annual Mojuma. Not what answers our question about Ansana no. So, would Yemia Osha Ghana hire 3-tier health financing system in the free primary health care or into more called CHIPS compound and the Sanyano Monomoho. And so NHIS is so abim. Na ebia wono oyare na nhyeda anye chronic malaria bi utibi ya wo ya ukwa NHIS card akọ hospital ombetimi ahwew ene ye wo specialized and high cost treatment ebia wonya cancer eno na enye yare ya NHIS card ni betimi cover wo cost nyina eho and a Ghana Medical Trust Fund, EBIM. And that's the explanation, or the am I know what to me at say, Yaria or Mono or Mobile Babeshe. It is a non-communicable diseases, or share be to say, or cancer, or cardiovascular disease, ebia, or coma ne, or Yaria, a how, or share stroke, or share diabetes, or share kidney, and what to chema will leave a what to chema, Sayarena, a boa. Oka bubru nipa bebre na into eno na omono ebem but will be the question of NHIS wo aden ye here Ghana Medical Trust Fund.
Your His Excellency President John Dramani Mahama the wisdom no dey be na catch us say what sense na we dream who deeply who be say na we so fin
yes
nti ono no purchase ade no yenye nte se pyramid
okay
free primary health care ne dasi
no was
and only chese was sorry now uti we yan ubiti me walk into any facility say me ko check me pressure I could take me blood I say Ekosiisen you understand me and no check you na say ye hu say e bia sebe when you siche yan and now uti we something else we move call national health insurance international health insurance only
pyramid in fin
so wunya wo your friend is saying wo diabetes na track akra na fi affect your kidneys ni ade na national health insurance dialysis or 3 times a week two
they sponsor 2
until at the end of the day we to now and unti no catch us say the moment it moves from that no na chronic na ye na yetisro what you say until baby national health insurance na end no Ghana Medical Trust Fund started. That's where we sit on top of this pyramid, no? Because at the end of the day, no, say nkanya Ghana Medical Trust Fund the buyer, nka we national health insurance,
it's true.
Ko baby
it's true.
And ani ampesa medical ho. Nipa ni bebre wo ho a, omo call beyond national health insurance na. Omo feel say me kwa broche kosa me ho yare. Baby a medu ni de say me ko India, say me kwa. Ghana Medical Trust Fund, it doesn't take care of any condition beyond the borders of Ghana. Into obi wo ho be frɛ o o si o me wo case ana me nua bi na o yare ya si yemfa ne ko India so it's any case ayen be no because obi the moment you decide to go beyond these borders you are talking about dollars it be more dear about 60 to 70 $100,000 that money no can take care of about 20 to 25 people if they are going through their treatments no go into me enye anything outside beyond Ghana. Thank you.
I think it makes sense.
The moment na edu yen so ha no facility bia ye be nunumu ehu se ho na ye betimi do treatment na kono na ye forward am no ma a kire yen nyomo be ye normally what they do is that they go through it and then they tell us we ye betimi aye it will cost us this much then we say okay then we go and make the payment for 50 pilot cases now we make the payment ahead so that hospital nyomo be ye bia omode be ye say we surgery say we treatment no my am what am I say? It cost us about 210,000 Ghana. Yes. It's ye kotiama Urake for so ye no omuma yen breakdown pepe of what they had done and then we have also seen the results. And do ko fie ye twenkra mana resume in the hospital mama kasa mama no asam che okakra. Patient or yare a ondwen ono na yare no yare hu. Odwen say ne okọ back akoje mana wo aji babies no me say first time I'm sure no you okay ye dey check na eko o say madam take care of me so I can go and take care of my women and I'm thinking say why what to do no dream say nia wo kwa akoje mba wo aji babies awo and that is a dedicated health worker Inti menon I was excited since nipa we say nia ye betimi aye bia ye ma no na sebe
it's true
ninkwa save
and imagine say without the medical trust fund 210,000 cedis. I mean, that's a lot of money.
What am I saying?
That's a lot of money.
And I also want to give credit to Omo ye take you over no.
Yes.
Omo amayen donations.
Okay.
Somebody like Ghana Gold Board. They gave us 2 million Ghana cedis.
Oh, wow.
What am I saying? Banks, see First Atlantic by 1 minute, 300, 200 individuals. What am I saying? Yeah, launch no more they buy individuals 500,000 yard. And no idea pilot cases. What am I saying? Okay. And the pilot cases we are estimating say you be 50 ni be we would have hit about 3 million Ghana cedis. 3 million Ghana already cedis. We've done about 1.4 plus million. And so far we've done 30 cases.
Wow.
What am I say? And I think that is a decision that you take here.
Why
nurse midwife no.
Oh, okay.
Rebecca.
Okay.
Yes.
Oh no call Urake.
Oh no call Urake.
Oh, okay.
Now me see that no mo ye surgery ni we no ewiana na me do because I just now dream see me so the BM say mami you be call ya or dam paso or da ho no or dam asese me maboa manate apo or call back to it.
Hospital.
And that is somebody unfunny human diagro. And it is any power say Mahama Kebuana. Can you imagine the kind of impact we have made?
It's true. It's true. It is a over YouTube, a live stream, and I will be video of nurse Nana Obobia Kanaho Asemno, very selfless health worker in Tinyamea Domanda, the Ghana Medical Trust Fund, Omotimi Tria the bills in Ama, ne surgery, you know, and we're very complex surgery by Ghana here, and that's the point, or drama home, Mama Yena, yet to me at it.
Sabi Obi, Mammy Fanka, Cadlabia, Yadia, Mammy surgery, ordinarily, in Kayibe Bieni to do. But catheterization lab ninety, and then almost the cord no name one, almost the cook pie baby problem no one. I'm telling you, pie trim. I don't know we 2 days are no coffee. What's my sin? I think I pine tree man cabano that's soda. And a card lab way, the whole of this country, you know, Kolibudi and Neja to Muno, inti Niana a Wawani Urakeno. The whole game. I'm telling you. Inti and then His Excellency the President at the Roma, Ministry of Health at the Roma, any Ghana Medical Trust one. That told me in some
Cadlab.
Yes. Yeah, the back home, Kolebu for no. Yes, some of the she and the new one I did. Esiho. Oko confirm no chair. You see brand new building or what? Yeah, the catheterization machine, SIM equipment in SIMU. Yeah, ICU or your friend is saying doctors no consulting rooms. Recovery ward near there. It's a whole facility on its own, full blown. What am I say? This is what for not here or more area foundation at Ekosiisen. Tamale teaching hospitals, the same thing. And I day you see okay. Kolebu pet na yensi dan wo because omo de no missing problem aye den aba hu kakra enche bia me the picture no be ma wo de si ho no we hu exactly what we are doing building na ye no.
That's really cool.
Inti me culture say in national health insurance na utie nkrofobia am say in can see German national health insurance for no omo ye hia say be yisika we e de akoti baby foforo na ye de obobi akotena no so onkofa sika ni ndi.
No, people should understand, sir, because I recall, sir, time HIV/AIDS, ebe2 atese ewo we are seeing, UN net na see who the need, sir, also create UN8 to specifically deal with HIV/AIDS. Yes. You know, even though now World Health Organization, sometimes you need some dedicated focus, to get some of these things done. Because 210,000 Ghanas is for nurse. Chances are that NHIs may not have been able to foot sa bail. It's important, sir. Sometimes we create some of these special purpose vehicles. Na etumi abwa.
Masani catheterization lab no building ne mediama domnekinti. Ombeti media so na wa. Kolebu dia no because yensi dining and by the end of March nyame adaroma no ma fix it. Yensi dining the first quarter me hoping by June no.
And base mainly for brain
surgeries your best friend cardiac centers. Yes, from consulting rooms to the operating areas where the machine will work to recovery room, oxygen plant, everything is in there. What am I saying? No, and back another department.
Oh, that's nice. That's nice. One thing is, even before I see a show pictures, and Yama Manfa Babi Huno, I think the Nipa Bebrina and it's eligibility criteria for support na day. It is a me tie obi ewie na mini bia or some of these chronic diseases. Now, me person also benefit from Ghana Medical Trust Fund. A quite many was a mefaso.
See, I need you started rollout.
Okay.
You started rollout and say a complex kakra. I say we need software.
Okay.
Now we connect all these facilities
yes.
Because they are the ones who are going to make the intervention for their patients.
Okay.
What you say?
Okay.
Into what we are doing, say software costing any medicines list.
Okay.
Into anunti na ama ne delay kakra, but the data ba say from 1st of April you be roll out.
1st April.
Yes.
This year, yeah.
This year you be roll out. Before I roll out, no. Wo say wo access Ghana Medical Trust Fund. You must be a Ghanaian.
Also ye Ghana.
Oh ye Ghana ni.
Oh ye foreign and now be yare wa Ghana ha. Ye ntimi fa show.
Yeah, beka ho say BH omo de beka ejuma. But yeah, act ne say must be a Ghanaian.
Okay.
Must be a registered national health insurance card.
Be ba cho ho me so mame. We ye Kumasi.
And ye si wo konfa noche any tamale.
This is really cool.
Inti area ye de bebo ho Ghana Medical Trust Fund Cardiac
Center. Oh, that's nice.
What we are doing.
Yeah, this is really cool.
Cool. Say foundations now have taken off Ninya, but Kolibu the train equipment now, but now you fix it.
Yeah. And when I say we hear anything brain surgery near
yes. So that you know that say near Tamalene ni enclave na wo Ninya can access from the teaching hospital there. You nim say Kumasi middle belt Ninya so be access wo ho. You nim say Kolibu so
southern belt.
What you say, and what it is that we put your first face. We are perceiving who send your first face, you know, and access, and send your baby, then maybe if we have to add more, we will add more. We no matter your health minister, Basso. Fantastic guy. Just which nana now 24/7 on that. We see 3 days here you do a parliament in person our bill. Me see and the whole day and I do me business and we did now. Say me here made them did. What am I say? Intino only movie every step on the way. Me dey meet me come and me honey national health insurance because the end they be a na. What am I say? We no ministry for no mo sika kakra wo.
Okay.
And no mo ba say sika na ye wo no. E betimi aye say adwuma we be half. It ye pese Ghana Medical Trust Fund for mo sika mo fan kam na yenye. Until we are doing it in collaboration with the Ghana Medical, with the Ministry of Health, to build the cardiac centers. Yes.
Oh, okay. Okay, that's really nice. And for more mutie you know oba obehu on ye machine where
your CT scan.
Oh, okay. Okay.
Where are you, Rich?
Where Rich? You remember Rich? Yeah, Rich. Then a whole big conversation. But in the meantime, eligibility criteria.
In the last one, must have a condition covered under the fund. What am I saying? In the fund, you know, you roll out, you know, you beka conditions na ye exactly.
Okay.
Inti wo be apply no e se wo hu say sa me condition we no we mo cater for. What you say? And na ye call around no ye meet subject matter doctors no. We realize that cancers no were on the high. Cancers no for childhood cancers, cervical, prostate, your friend is saying breast cancer now you're too high when we got the data for it. Into what the board of trustees any subject matter fund decided say let's roll out to the cancers, especially because of the childhood cancers especially. Into what we have done is that from the 1st of April you roll out now we roll out to the cancers.
Okay.
So that as we go on, we keep adding. Into ye kono, ye the cardiovascular, ye the stroke, into ye be in faces are a be smooth and ye be a cover obia.
Okay. Into our way Ghana ni, I was registered with the National Health Insurance Scheme, and I was said yare no a folly and a list.
Thank you very much.
Good. In the when you satisfy our first 3 we are now we'll move to stage by then
how to access the fund.
Yes.
And the fund ye patch or say one kasani you cannot access the fund.
Who
patient won't to me access the fund. Say be doctor no show no no name or medical history or no name or present condition or no name nya ube here going forward. Into doctor no show no or no or corner system no so software no tab no or click here obetime enter with details ama your medical history actually ye how any near treatment a wo hia ne ade na abayen ye ho a na ye review. Your technical team always on standby. They will review it and then decision will be formally communicated to facility now with treatment say nye sa facility na apply ma ono say ye hwe na ho no ntimi nye treatment wo yankasa ye be refer to the next facility. Yes, but then at the end of the day you will still be patient. What you say, so you'll be under us, and then we can say that case where you won't say be a kolebun to me, you call Urake, but Urake will admit you as a Ghana Medical Trust Fund patient. That is it
for the consenting, and ya dear say we patient as a wood roll out. Assembly na kofa form be na fairly say are into Ghana Medical
and what we have also decided to make it ease the burden, especially region BIF regional coordinators. So regional coordinators in the facilities will give them small office and a desk
hospital.
Thank you. Into doctor na apply on your behalf near dear or better say or more office so then you go and she herself not at the end system niche a doctor na apply then what she would do is to continue to make sure say team na wahano access or application I agree say you qualify. Sometimes you will not qualify. What you say, and they will give you the reasons why. If you are a document, be here, and I be a BBS follow up, BBS away na BB. That coordinator Nijuma no. And the coordinator no so. If they put you on maybe chemotherapy treatment and na BB, na say and then wamba for treatment. Ochina wamba. Onim baby a wo onim baby a wote obeba be hwehwe. Abebisa se dentina o treatment we woda so na wamba anasa woba na bia bibi further say ye and na bia o mo realize say bia o case no akọ beyond what they apply for ye coordinator na be say adwuma we nya communicating with us here and then we will make sure that all the necessary actions are taken.
In the meaning say doctor say emfa say when ya cancer for example what started treatment no ebia NHIS afa initial cost no but doctor will show him who say o cancer na edru worst stage in the way the treatment they was say is scaling up kakra NHIS intimintia na doctor na refer
straight to
Ghana Medical Trust Fund. Okay and he say mutia mesrese mu betie ne very very important na ochina bi nipa bebre na amfa mo request ama mesa line wa say obi unu yete say woni obi edi nkomo and your request ni e monye na mo van koma Ghana Medical Trust me pa cho o doctor o show na we say a referral no e de amount na omo no etumi etwa inti as many referrals as possible are ebeba no the guarantee is a mubetimi etia ninyina
ebetimi ayi ninya otimase cases na eye bibia me fa say ye roll out cancers any cancer case na be ban so far as doctors need chance we ye betimi ayi adwuma we are good to go. We will work on it.
Say ebase now the doctors may not have to refer people abroad.
No. So doctor need decide they say so ko abroad you cannot access us. And not just say ko pe usika will be before now.
Okay, that's fine. And I think that clarity in so no eboa but also wotie me na o question be at the the administrator of the funder ubetimi at the questions no aba na afei mebusa no at the amount wama mu ehu so far and so far you set up fund we it's the first time amunya budgetary allocation this year.
Davi. So last year no my budgetary allocation but because na ye new nti yanko say yanko pass wo parliament na bibi last year no from the time that's in August National Health Insurance gave us a quota 20% from August to December. What's my say that one we have it inti no na sisi ano ye de be ye first equipment procurement for the facilities. What I say because obi wo say adentina say yene yekoto equipment ma facilities then we have no business paying for the medical bills. What I say enye juma because
equipment no muntu me hwe nkofo.
I'm telling you equipment no nka catheterization lab no nyese urake for wo bia nsanka ma me no da so tifia niti aye dududu o ye no hwe a enye yi. Nti I'm just saying that ye pese amanfo no hu say enye medical bills ni keke hu because medical bills will betimi etia but equipment ni wa what me nye adwuma and I say ye call parliament me hu say seven na ye nkrofo ni bi wo ho a they were very concerned about say adena sika no mo pese mo de bi be equipment, somebody be infrastructure. You have to push all the money into paying bills. But then that's a little education we need to give them. Yeah. If we do not have the equipment, we cannot simply roll out this mandate.
You cannot pay bills for treatment.
Only equipment. What am I saying? And that's the example of Rich Hospital when we come to that. Nipa be 1,000 walk into Rich Hospital. About 200 go on admission. 800 no okumu doctor na doctor catch and say kocha x-ray bra and now catch us say kocha CT scan bra and MRI. Just a would cheat no doctor no. Now ko baby fufro. Now kocha now deba. Inti bebre no mo work out so mo kocha but mo mba bium because oko private facility na no boy thing. Inti on to me oko onye den. On mba bium. But I'm saying, say you to me boy, near desire equipment TBC Rich Hospital. Oko na doctor and trauma wa ubora wa test. And as equipment our hospitals wona. And no na boa mo ankasa no omo to me your friend is saying omo di be show omo manage omo niema. Until at the end of the day, when the equipment are not in the hospital, the Ghana Medical Trust Fund simply are tied.
It's true. I mean, it's a no-brainer because for bills for treatment, the treatment first would have to happen and then the word bills. And if there are no equipment for the treatment, then the fund will just be
your friend is saying test now. Doctor no be dey hu ne how ama yen kra ya kwekutu aka nti eno na me pese Ghana 40 asia kakra because me hu say ehon dey in contention kakra enya ba everybody simply think that be sikana mo de beto equipment say mo de nya kotua hospital and in any case we are not paying for every medical condition.
Sure,
we are paying for specialized medical conditions. Chronic.
And the equipment you are purchasing also near your normal hospital equipment.
No. And on the primary healthcare for NATO, you did take your pressure, you did test your blood, and all the other near marketing kitia, Ura chips compounder, Ura district hospitals near there, Ubenya, and on a almost saying Yafasika, Akotosa near money because and on Enka Yejuman, yet a specialized medical equipment.
It's true. Ain't Yemra Meshe, I mean, after more call around every facilities about purpose money 1 year, Jumano, muhu gaps be brave. And the critical one I jump here to be a rage, you know. And it's here for Bekaya last week, yene obo bia din come on phone. And yes, Mobose and as within this week, Bekaya and Sawu Studio would launch a partnership between Yen and Omo to help raise funds. Now they are top critical equipment be a Rich Hospital here. And for more money, Rich Hospital, a Greater Accra Regional Hospital in the whole Greater Accra region. Regional referral center enono in it's a massive issue. So also video where a time a team echo the Greater Accra Regional Hospital Rich Hospital omoko koto facility no to know gaps near there inti obia mudru Rich Hospital what did you see hospital ho
say your first one needs assessment.
Yes.
Na yenya raho no sabi doctor no share any team ni ade no na omo ka chen gaps ni ade no on fa yan go round or ka chen what the problem was equipment omo ni ade nti na ma adwen man tene me papa nti ye wie no na ka chen no betse he say you take it time na ye call Rich Hospital just to go and see what equipment they have and what they do not have. Manu insi and a medical director no throw me letter say omupe hiambwa because for omu facility they do not have a CT scan and MRI fluoroscopy x-ray ni ade ohona me ka che no be say semi ameka yen nti every time na yen dey yanko honko hwe exactly what the problem is and nothing am I too sana
mo you know
and to be frank with you me say me na me tell me come say what is happening?
Regional Hospital.
And the kolebu chiano ho kakra we na nke beso yemu. What am I say? Ena omo renovate ya papa President Otisu Sisiako Biano.
Sure.
It's under 10 years now. I'm saying 10 years more.
Yeah, 10 years roughly.
By 10 years now medical equipment be on by 10 years now the end of 10 so there should have been a plan
to replace.
And it hasn't been done. And then equipment no po to 2 years is on ninya won say the end of term maba nti esisi wokeke nti yes corporate Ghana beginning of the year corporate Ghana for ninya obia won its CSR budget. Yes wrong. So we dey nkan find pilot project for corporate Ghana. Yen ka say corporate Ghana etimi a retuli rate hospital. And I think it will be to their credit.
Yeah, it's true.
And one thing I don't know, I'm very emotional about it because inka esi me fa se sunyane ana baby ayebaka so okay bia baby e won na bia load ni won ade. But I'm telling you that one we ni kra every single day ka say 800 patients go to the rich hospital. And then some years will be a true who say or rich hospital you say left us say or mom or yare or mom nine intimi kukuro mpo nkosoro. And I'm thinking that in this day and age you need to in your situation especially
and for obia otin anadweme say oh we cry a toko wia obehwe the same problem the rest aba omo nhweso ye na waka say equipment bia mo beto akono. Management of our equipment.
It's not for the hospital. No. And we have told them already. And now what I'm saying is, when the corporate institution decides to do it, they do it in partnership with the Ghana Medical Trust Fund. Yes. And make sure and for 2-3 years, yes, I say, and I'm not sure it's going to be the same thing this time, especially because the Ghana Medical Trust Fund is here.
It's here, and it would help in the management of the equipment. He say, company. I mean, him say companies CSR, money CSR no keke. Sometimes we pay the necessary positive mileage, and that's why we have come in. Say, so we a corporate organization na our budget kakra opese wo de eboa ema yenya these critical equipment ewo Rate Hospital in Kranha. Oba would give you the airtime ewa brabeka magana fo nyina entene yenhu the positives our company no eye de eboa okokohwe room na sisi ahwe oh Charlie. You know, and that's Rate Hospital for you. This is Greater Accra's Regional Hospital, and I will share equipment is we need to retool all of these facilities. The Ghana Medical Trust Fund the Atuwon I launched this campaign and Ekosiisen and Suyadi and Toma Abo one day and say all the necessary publicity needed there was a year. Emma amount for etini who challenge a war Rate Hospital among some be home. But we say individual be 8 na akana koma or will scare you up or the eboa and also a quine or horse. A quine or betimi about or betimi no wabba bonko or bet ube frame yapa donation in the amaya yadana so you see cancel your betcha juma yedi in the baby in your bay account be mobile say we in a tollway we in a company we in a tollway ya say equipment be a company be decided so betono ye bit yebema or more branding the main fans a gold board banner saying the metal MRI Rate Hospital yeah branding them gold board and a dynamo some equipment in Sino will brand the room this equipment was donated by gold board. And any other agency, individual and now per se do the that will be done. And they say, this is an opportunity for all of us. And we a company, we a individual, and Rate Hospital needs our support. Or Chenebi ABI to our set. Only the closest hospital you be rush with work or be MRI in the or X-ray machine in the that's
and that's terrible. Health issues in Ghana Medical Trust Fund in I just want us to discuss it passionately without any political leanings and bibia, because at the end of the day and they will tell you and I bibi yo now area wa and I bibi will take cry you page our rich hospital say do kwa yen be say we party card we here na we wo fa ne hwan na wo aunt ne hwan wo rahwa na yentimi amboa wa yentimi amboa we have to discuss some of these issues without
politics. It's true.
It's very important.
It's true. Ma memfa we in some few messages na fe yem try and common we say obe the Mahama Care according to the act is to provide financial assistance. Ask Obi, is she receiving 100% funding from the NHIS? Secondly, how much funding was allocated to her in the 2026 budget? Thirdly, will she be seeking public funding via support to enhance her office? And now, how many patients is Mahama Care going to take care of? Or is it specifically special case? Nana has your jury. Nana, most of your questions now have been answered already.
Any message you can give? Mami read it from act.
Sure.
We'll call point 3 now. Or sources of monies for the fund. Or see 20% of total monies allocated to the National Health Insurance Fund.
Okay.
That's the A.
Okay.
B, see monies approved by Parliament.
Okay.
C, or see monies that accrue from the fund from investments.
Okay.
D, or see grants, donations, gifts, and any other voluntary contributions made to the fund. And E, any other monies or property that may become lawfully payable or vested in the board of trustees for the fund.
Oh, okay.
What's it say?
Okay.
Yeah.
In the Sikabia, by the for example, Parliament approval 2.9 million.
That is National Health Insurance 20% for this year.
Oh, only 2.9
million.
Okay.
What you say? But apart from that, yes, yeah, marketing kitia, you been scanning be account because you roll out as scanning won't be enough. We need to look for it elsewhere. What you say?
And so far through donations are companies Mwenya sika emu edu kakra.
So far for last year as at end of year na yenya almost about 6.6 million Ghana cedis from corporate donations. Yes, corporate institutions, individuals.
Okay.
Yeah, well, individuals are bosomi bia. I know a gentleman or head of agency or one of these government agencies. Bosomi bia ne salary o pay it any.
The salary.
I'm telling you, ninya auditum. We have another person almost every month be on the 100,000 Eko2 accounting. Only the two we are not sending a slip of mine. And see, there are a lot of people who quietly are making donations to us. What am I saying? Auntie, obitini baby no Jane say, oh wait there is about Mahama copy gu ye to us here.
Oh no.
If it survives for all of us. It doesn't survive for just President Mahama. We thank him for his wisdom. We thank him for the decision to put this together and make it come into fruition. But I'm saying that this thing will outlive President Mahama. And if we build it well now, you will benefit. I will benefit.
Of course. Anyway, now what kind of act no? There was a portion that said sika mobenya through investment, meaning say moamu invest sika ni.
Yes, to say last year say because apart from staff salaries, any setting up of the secretariat in Yadian, yesika na buy, we have to invest it.
Okay.
What am I saying? Against this year.
Yeah.
Into investments a year for last year, it accrued 3.7 million. We generated 3.7 million out of Yesika na yedeko investments. What am I saying? Yes.
Wow.
Into yes, Sika na da hokeke. Sika no ye juma no so woman yedi other nyema.
Oh, that's nice. That's nice.
Apart from that, your strategic partners, Telecel Ghana say, or more my cervical fairness treatment beds near there were ebi o kolebu ebi o seshi ebi o tamale otima say mano cervical cancer mo call for testing near there Telecel Ghana donated it to us. What am I saying? We are hoping that this year they will come with something else. Yeah, well, another one by a friend, Mercy Ships.
Yeah, Mercy Ships.
A bed docky in July. It's here for 11 months. And no, a surgeries across. They are hoping to, I think, about 10,000 surgeries, and then it cuts across all these chronic disease ailments. Surgeries, tumors. We are also talking to Project Cure. Be on Project Cure. Project Cure. Equipment. Sometimes it be a slightly used, it be a brand new, but they will ship it to us. And now your mandate to know so ship it on your ministry never clear my free of charge. They are Chama hospitals. There are a lot of things that we are is in the pipeline. Your name say Eba into fruition. We'll be good to go.
Sure.
And then if we are able to train these oncologists, cardiologists, nephrologists, and doctors and nurses for critical care, now your name say we are you do you be specialist man.
That's true. In the wood seminar, question be now we can pick a lot of your questions now. We are no Eddie Amayin 0548 443 523. Your WhatsApp number and on 0548 443 523. For our messages no ebre. Obi, tell my sweet sister, we are the National Service Authority would love to help a lot with the wonderful work she's doing. But in case we can support with chicken and eggs or even maize, we are coming there soon. But all person she must let us know. We shall post all of them to her free, no service charges, as our support to the fund. Into Darko-Opoku or a Deputy Director General, Finance and Administration, NSA. And there was also here service personnel as well. Sure. We say Obi, Madam Administrator should condemn the blatant abuse of power by her government. It's more cancerous than what she's talking about in your studio, Samuel Brian Boabeng. But I will support her if she can boldly condemn the abuse of power.
Now do hospital baby say NPP card way and now NDC card way. Monta on your politics na nitia ni catching some on frame.
We say Obi, can Honorable Obi assure us that the system will not be hijacked to create a waiting list which might cause people to pay bribes to access the fund. We have seen examples at the awarding of scholarships and others. Godi in Tema.
This is different. What am I saying? There's no queue. There's no nothing because we call Kolebu, me call Rage, we call Konfanoche, me call Sunyani Hospital, we call Urake, me call your friends Bank Hospital. Where is the queue?
Once the doctor recommend
doctor no be intervention amount. It is a sure na doctor no on the software na receive within 14 days no when you maybe the requirements ni bibia ako back to the facility. Until there's no queue or anything in this one.
There is a testimony here where say Obi, my grandson is their first client or patient. I am extremely grateful to this lady. Because of her, I pray that this fund would always be headed by a woman. Your uncle Kwabena Sapon and on the way about Ofa Kwabena Yedase Papa.
Sabi Ofa Kwabena?
Yes.
No ko bia ti baby nanka ye the NDC ni MPP card na ya nko de ni case ba nka menje.
Nka unfi no.
What am I say? Say ye nya ni baby oju. But at the end of the day, that little boy did not deserve that. Inti ye nhwe ne nana baby ojina anane aunt baby ojina na nebusuafo ojina no mfa ye hu. Ye dwuma na ye we are here to save lives. Exactly. Inti and then young man while yes surgeries were IMAC almost 2 times. And in we have been able to take it. That is our first case. What am I saying? And every step on the way we are there with them. Now every step on the way. And it's a case that Makuma DH papa because I think that young man is a fighter. Situation no woman Obianka will give you up. But every time you didn't call surgery no papa, you didn't call no wapa. I think he's a fighter, and we are supporting him every step on the way.
Well, sir, Obi, good afternoon. I like the energy of Madam Obobia because the fund is now taking off, trying to pay for the infrastructure needed, including equipment for the management of some of these chronic diseases, makes sense to me. However, you wouldn't want to have a situation in the future where most of the fund might go into procurement of infrastructure instead of the core function of providing financial access, i.e. paying medical bills. I therefore humbly submit that we capture in the law a maximum amount of the annual budget that can go into non-core activities, say maximum 15% of annual allocation. The CEO of the fund has energy. Like I said, she deserves our support. We're Dr. Bernard Okoboy and on the way up. But his suggestion makes sense.
It makes a lot of sense. But we share your way no more non-core no. Your friend is saying 10%.
Oh,
it's in the act.
Oh, I will ask.
Yes. Okay. At the end of the day, what I'm also saying is Obi, MRI machine, CT scan. So what do we see for 2025 now when you see it? So next year won't go to be. Because they'll see every year they'll change it. But to start, we need to do it because facilities they don't have it. Most of them are more lifespan 10 years. Until next year, next 2 years, me can't show some equipment. We will look ahead.
I think the only thing will be budget for maintenance,
any consumables. What must say? Until Bia or Tia Jumana said to say Dr. Okobo unim say near is in the right direction because your equipment now into me.
We say, and this from a pastor friend of mine, will be can a private facility refer a patient to the trust? Yes.
Very important. Right? We can take it. Yes.
Okay. Into a private facility, that is something that can be done. This one says, Obi, a family in Takrade has sent the medical trust fund an email on their support request. How do they follow up? It's been 3 weeks now, and their father has a communicable disease diagnosis report. In the way family cannot on their own send an email.
Obi, I don't think I call 50 pilot cases. No, and what we are doing is the 50 pilot cases. 50 pilot cases need their individuals can apply.
Okay.
Yes, so you send your request to the email, ask the GMTF, you will take it over. It is a sending meet me the number to we'll do because that case is not we have taken care of it. Because what we want to do is say we want to use the month of love this February to complete those 50 cases and say that we did it in the month of love. And he said was sending you bet me a number now if you are able to send a message to the person and come the number catch and so on fresh number if you are email if you are drop you and be a cost spam and it's possible but I'm not sure say Dr. Norbert Kipu he is in charge of 50 pilot cases and you're meticulous. I know that there's nothing that Ebefani needs there must be a problem into on fresh number
with the 50 pilots individuals
can apply. Say no the test system. That be say 30
and still some 20
30 until we have 20 more. So far we've done 31 patients. But we are doing 50 and then the ages are between 5 months to 70 years.
5 months to 70
years. And we've done 12 males and 19 females. Yes, and the beneficiaries are from 11 regions
in the country.
Yes. Kolebu Cardio Center. Yes. As of last week, we have paid for 11 whole in heart surgeries. Yes. Until so far, we've spent 2.5 million on the treatment for these
for
31 patients. We and I'm say yes, supporting for corporate institutions. That's the 6.6. We want to use at least 5 million to do these cases. Yes, and that is how we want to launch. By the time I launch on the 1st of April, we will be proud to announce it's saving 50 lives.
It's true. It's true, and that's a lot of money there. I mean, 5 million Ghana cedis, Charlie. Wow. Let me see the other messages. Abawese Obi, Honorable Obobia is doing well. Now, on the end, okay, the only challenge is how the medical workers help in destroying government-bought machines so that patients can visit their privately owned facilities for them to collect exorbitant
and that's
charges.
why we're promising that it won't happen again.
We didn't see you because
the trust fund has a lot of time to take care of your equipment.
To manage the equipment. In the Kweku in Guildford, UK, and on the way about Kweku, that's loads and loads of your messages. We say Obi, the president and the health minister have both said the government will go the PPP way,
yes,
where the private party will do the placement and manage it. Did I hear the administrator say she's procuring the equipment for the facilities? Can you ask her if you can get me her number? Okay, George, yeah, that's it.
His Excellency the President, the plan let's say PPP.
Okay.
But PPP no, you better arrangements, agreements, you better sign MOUs near the end. It will take a bit of time.
Okay.
So that's why what we want to do for the facilities, we have captioned it urgent needs.
Okay.
It before PPP for near the end, you better set up building diagnostic centers no facilities no my years age one year there. Now kitten na here say you do see what my year rolling out no. Na to me I am wage one. Into PPP there is in the pipeline and no dear. His Excellency the President what's now no bon come on the first thing obekani PPP no we should allow the private sector to invest in those especially the diagnostic equipment. So in the end there is something that's in the pipeline. A lot of them have also come to see us. They've made presentations to us, and we are also speaking to the ministry so that we can collaborate, see who we are getting on board, and then they will also go and set up their diagnosis. But in kakra, tisa ha CT scan, I have for being MRI, I have for Obi. Can you imagine? Say the whole of this country, October, you branded the whole town pink. Ubeko corporate institutions, see, the pink are sehonya line. Mammogram machines, regional hospitals and teaching hospitals in F5.
The whole
Ghana.
Really?
Yes. It's what I'm saying is until why are we making noise? Yeah, noise here. No, be Savugu. No, so mammogram, na bibia.
Machine.
Was sorry, I was made default me. Person me caught testimony no for say bibia you okay. Just so far car ba Tamale teaching hospital crowd does not have. So how is that person? And then, so what's he rolling out without these equipment? Let me give you the scenario. Obi yare wo me fan said amangwa. Na so here catheterization lab. Ese me fa no. Me fa ne boafo ka ho. Me twa car o say plane o de omo bank ran. Hwehwe baby mo omotema. Ekotua na omo koye sa test no urake. No munya omo results we na yehu ne omo be ye ne nya na metua accommodation metua omo feeding bibia. That one will have a toll on the fund. And we cannot afford that.
And a good way to manage the fund.
It is a offer baby to sell Tamale Teaching Hospital. Now see me retooling ho into Obia was surrounding area. Yama lorry fair percent at least ubedu. Now say yes it's so munya ba Confanoche any Accra dia see you. And the fund no it will collapse.
It's true. We say Obi, can she throw a bit more light on where they are investing their funds, farming, T-bills, or where? Because we're in this country when an agency invested with Men's Gold. George
Everybody who knows me knows that I will not do such an investment. And now we have very decent banks that we work with.
Okay.
You understand? Okay. We're working with NIB, we work with First Atlantic Bank, we're working with Omni Basic, and then we are also working with Universal Merchant Bank. Into Omunya, so at the end of the day, you started, they came to make donations to us.
Banks.
Yes. Until then we decided to work with them. Until they are the ones that sorry for a bicycle. Everybody who knows me and the little I have done so far as my political life is concerned, reckless.
Sure. It's true. Wesa Obi, brilliant, phenomenal, and a very great initiative. But why the name Mahama Cares? Because it will be turned into politics after our president leaves office. The name Mahama Cares, name Ghana Medical Trust Fund. Yes. Reverend Eric Sechi Ofori, and this our message. Reverend Inti
Mahama Cares in the IT say nickname for the Amano, but I'm not sure that is the name of the fund. The name of the trust fund is a Ghana Medical Trust Fund.
Okay, very well. We say Obi. Okay, Obi ascend support Ediaba. Or say me and Fanny Dean and Trigger and
Yetana Sepanya Mishran Papa.
Okay. More. Do you have a number out as we can Sunday? Mumu and Nasi Bibisa.
You know, your friend is saying a hashtag, you know. Your friend
short code.
A short code.
Okay, I'll go over that and sorry.
And the bank details in here.
More Mubusa for Sawe until we'll go over it before as part of the project I hear to retool the Rage Hospital. At least equipment Omuhiani a very critical equipment. Said Obobia air cano MRI scan, Omuhia fluoroscopy unit, Omuhia mammogram, any addition and no foot to check breast cancer any other, and Omuhia CT scan. Ewointi Samuel and Ayesha say Mobitimi Abwaye ne yato edi esi very, very important. Obi, Madame Obobia is an exceptional individual, and as the newly appointed administrator of the Ghana Medical Trust Fund, there is every reason to be confident in her leadership and vision. It may come as a surprise that the entire Western region currently lacks an intensive care unit, a critical healthcare facility urgently needed to address severe medical cases. Recognizing this serious gap, the Western Regional Minister has initiated a fundraising campaign to establish an ICU at the Takrady Hospital. Given the urgency and the potential impact on healthcare outcomes, I would like to kindly request if Madame Obobia could use her influential position to facilitate the allocation of funds from the Ghana Medical Trust Fund to support this vital project for the region. Thank you. Boga Ali Hashim and Onodiwe.
Boga for letter, bra. You can write to us. Make
the regional coordinating council can write.
Yes, write to us, and then even the minister now while launching we Obetimi asking for a meeting with us, so we can discuss it and then know the way forward.
And because intensive care unit,
no, it falls under chronic
that's
it
fine.
Falls under.
The Honorable Joseph Nelson Utia, this is a good way to go about because also the power buyer as regional minister who said the whole region need intensive care unit.
And they will write if you are Quantaobi. We will not come on. We will be so.
If you are Quantadia.
And I'm thinking that oil companies in the Petroleum Commission, Ghana Gas, more operations were. Red World, it is to me appeal to for them to understand how it is urgent to retool if you are like that, they will do it. So why they take his step? What am I saying? Feel is a regional minister is Obana Yebon Koma. You beat me Ghana Gas. Remember me Judy to if MFA or Petroleum Commission. We can go and talk to them, and then they will take the first step to help. Medium feels that they should come and then let's have a conversation and then move it from there.
We say Obi, good day in Russia. Where I am currently, even polyclinics have machines that regional and teaching hospitals don't have in Ghana. So it's a good call. But my question is, will government appointees be willing to devote a percentage of their salaries to contribute to the Ghana Medical Trust?
I'm happy to announce that January, half of their salaries. February, half. Yes,
half.
For the Ghana Medical Trust Fund.
Half.
Yes. This is a controller of a culture. January they check no cry already. No,
government appointees.
I'm telling you, Deputy Chief of Staff or no GG
because half the adults.
Yes, President launch. That was the promise, and then that's what they have done. President Nankasa is 6 months salary straight from controller. Yes. And yes, everybody wants to help. Well, who's sending Victor Mampo? Sorry, that crossing the staff near a donation. 800,000 Ghana cedis he brought to us.
To the fund.
To the fund.
NHI staff
decided that they were going to contribute to the Ghana Medical Trust Fund.
That's 8 billion.
I'm telling you, one or pan of friends say, maybe. He came to make that generous contribution on behalf of himself and his staff. Oh. Yes. And I'm thinking that a lot more other...
There was an MPF once staff.
If they decide to do it, they will do it. When I went to Sami Jemfi and said that, boss, you have to help us. It didn't take him 3 days. He called me and said, Obi, men yaska kakrama, koji or me deputy or me neo. Last year he gave us 2 million. I know this year he will do more than that. Wow. There are people who simply look beyond a corporate institution. There are people who simply think that when you help this trust fund to stand, there are people who are not thinking about trust fund. No. They are thinking, say, when I see people like Sami Ghana Gas, last year, yet one of friend, or some mumbra, Sika better equipment, Sika, better Babuamma, Modia running off more office name more up and down. 300,000 she gave us. What do I say? Indeed, there are some of the CEOs that when I because they are not looking at individuals, they are looking at the bigger picture.
That's true. Yes. Inti Yaira Koku Tiemia
national identification.
But at least lawyer educator maklo betimi aboa. Lawyer educator maklo MP staff ne form the emra. Na MP ankasa nso mfa ne de emra ebeboa. Ghana Gas for etu ana monti agencies in the bebre GMPC money omo ekeka ho nyina no. Emfa we say Obi, this is visionary. JDM is visionary. This is an intervention that when managed well would have a great impact on our society. The question I have for Bobia, however, is does the NHIA already have reps in the regions or health facilities? If yes, won't be a bad idea to add this as an additional responsibility to those NHIA coordinators. Could save some cash. I think it's in reference to the point I can say you would also have regional coordinators in the facilities.
Yes, but to me you see NHIA for no because how much money are different.
Yeah.
What am I saying? They are virtually like chemotherapy data so one call. Onim baby awuti.
Yes.
Or be hwehwe we be say then and there with treatment no one call. The say we're a hospital hold on.
Yes.
Doctor no are on board the way we no. Oh, you can walk into the office obeba no teho. Now what do details nya de nya no what try say doctor no say o treatment no ye be ni say inti ya on board o inti obeba Monday, obeba Tuesday, obeba Wednesday.
Yes.
What am I say? Yes. What we are doing is that yes I'm on my mobile so that they can go and do follow-ups nya de. Say money it mean GMA National Health Insurance for say come which man who region until we need our coordinators there to say Greater Accra say if we decide to deal with 6 private quasi for here and say assigning Kolebu ne Rich Hospital. Yes, that's almost about 8 to 10 hospitals.
Sure. We
need people to run around and do the work for us.
It's true. I think it makes sense. We say Obi, is it the same hospital whose roof is leaking on Obile Duasare? No, and then a 37 in a Clifford, Burlington, Canada. Now a 37 into Shannon. So MIA. We say Obi, no matter how much effort she rather young couple into we say Obi, how about medications and prescriptions before and after treatment? Does the care cover that as well?
Exactly. We have a medicines list. Until we want Novartis, Pfizer, or Roche. Ya start your catch form price list yes so that we can come to a middle ground. Cancer treatment in we have a medicine list that will go with our treatment. And yes, the doctor will prescribe your medical trust fund medicine list
that's nice. Yes. Obi, Madam Obobia is the right person to have been appointed by the president as administrator of this fund. The president was very intentional about this policy, a very life-saving policy. We trust in her capabilities and we pray for God's guidance and protection for her and the entire staff at the GMTF. Kudos. Abdul Salam Ewo Cadiz in Spain.
Thank you.
We say, hi Obi. The beautiful aspect of Madam's case is that she says the medical trust fund will be monitoring all equipment purchased to all hospitals. Hence, let us support this project. Papa Bisiu, was Spintex Accra.
Thank you.
And on the way, Abba Papa Bisiu, yeah, that's it, Papa. This one says, Obi, good afternoon. I say, Obi, on the back of what happened in Tema, ask her whether NDC executives will not come and lock the machine by saying they have not been employed. Kawore or Lincoln in the UK and ready to me in Siripacho. Tema, I think the news is that it's been resolved. The Tema mayor, Akwa Shama or Matoto. Domi, Sanete, right? But you say mayor Nako, NHIS office, I'm not saying Ashe Ebi. That's just for. More questions on that. Obi, thanks for the good work you always do for Mother Ghana. If I may ask, okay, into again, Mahama Care enye policy no idie Ghana Medical Trust Fund. Into Montiazebo say it's a fantastic policy after listening to Madame Darko-Opoku. Thank you. We say Obi Honorable Obobia is talking about training specialists. Yes, the government is sending our trained specialists and experienced nurses to Barbados. The action is weakening the same healthcare system they want to improve. She should talk to the minister about that somewhere.
Specialist nurses.
Yeah, they are mostly general practitioners. They are mostly general practitioners. It's true. Ekosiisen is the higher Sempa 94.7 FM in the Yao Ejei Kasmo or Jamasi Buenim Atonoso Ose Buenim Hospital in Su Ehia Emwa Inti Omo Emra Honsona Omo Buamo I hear. This one says that Obi, please ask her how much are we paying for renting the secretariat. The amount per month can build one chips compound every month.
This is mischief.
Executive Fred Ewelejo Kuku. Now I own him secretary.
Rent about to me to chips compound.
Ekosiisen is in the higher Sempa 94.7 FM. Lots of your messages. But we say Obi, I'll read this final one here and wrap it up. I'll be grateful if you could connect me with the administrator of the fund. I'm pleading with you. The surgery is being scheduled for the 10th of March. Okay, or the I send the document. Be near the asset.
But your number na forward the man so on sending up because this year 31 into your sports no esa into your own car no farm na pilot cases.
I'm writing to ask for your support. I'm facing a medical condition, need surgery. The cost is 19,190.
It's possible,
and I'm seeking help to cover it. Okay. In the Eric Kweti, I'll send you the number. Yes, na etimi abwa. Bengazi for short code no etoso mame. Mo amoshe wo YouTube no. Short code a wobetimi se wo mwa opese wo de eboa ema ye retooling Rich Hospital as part of this campaign. Ekosiisen any Ghana Medical Trust Fund yaka bomo a me pacho o de wo mwa no be fa short code we so that is individuals a wo bi kakra wo betimi de aboa no o de be fa sa short code ne so se enye sa na ye company aha short code no anyway across all networks *255# *255#. This month, the month of February, a year month when you fan let's help raise enough money na yemfa emwa the Rich Hospital into a free echo every day at Nasia yebeba hunde rumishel so we a company na uwo big donation bi upesa we ya bra or they just walk into our studios what is about airpe nantebra oba yema okwan na unso wabo donation hu de wabo company hu de adwuma company ne yebema okwan na unso amagana fo nyina ate wonka just by the mere fact that we donated this particular project in the open to every company momwa ye ne yentiminya equipment no emfa emwa the Rich Hospital here in Accra very very important in the mention nso emfa emayen obiama yenna seba Nita Ekotego says, Obi, please tell my sister, Madame Obobia, that some of us genuinely want to contribute to the fund. Just that her government is holding on to our ex-gratia after 13 months. So once we receive our ex-gratia, we shall contribute to the fund. She should tell Honorable Atofosin to pay our ex-gratia. Why? Charles Nita Ekotego, also Tantra Health.
When you have friends like this, you don't need enemies.
We say, Obi, tell Miss Obobia, her beauty is magnetic and lights up every room. Yours sincerely, Guy G. Cantonment.
Obi, and you can answer.
I saw them Charlie. Yeah, that's Obobia. I think it's been a very good interview. Thank you for opening up to us. As and when I in Sabeka donation be mama munsoma swate
and I also be by a whole no or interview, so I'll let you know so we can work on it. And so far also we have had some calls. Okay. I'm hoping say by next week you clarity in I'll let you know, then we can announce them. If you almost say almost rest assured say yembo mudi inti near din kind of medina sebema we tea funya say mama ya penyana yetimi ababeka medical trust fund ho asem yeah Papa John Dramani Mahama bibi obia yechia no. This is a very bold ambitious initiative, and I think that so far the foundation is why governments upon governments, everybody will come and build upon it, and then it will stand the test of time.
Super.
Intermediate meaning say the Ghana Medical Trust Fund is here to stay. And near Twaso, me staff na many me bomb my boss on my idea. They all know say idea we. Yeah, yebebo yedin, anye ya, yebebo yedin. Iti obienia brigidi say enye den enjina. Inti almost yeda omase. And ye very active on social media. So inti Ghana Medical Trust Fund on all handles, you can find us there. You can leave a message for us and everything. And then we have a button called Ask the GMTF. And no question be you can send us I'm sure by next week so your website will be out. And also so I'm very important. Very important. Apart from everything, you better Ghana for us because we couldn't have gotten to this point without more help. Any senior or more RCV in the various regions, needs assessment, and then the medical directors, the medical CEOs of the various facilities. My goodness, I should send you some pictures of me and them. Or more family so munia, you see, and they have welcomed me into their space. Although school no mango be say medical doctor, but they have just taken me on, and then bibia they work with me from meeting or mobeba me the message cause me pempa me patient or mobeye intimate or massive from Kolebu Konfanochi Sunyane Tamale, all of them me down massive papa chese or mati enim any the head of the your friend is a Professor York.
Oh, of York. Okay.
Then as a Ghana Medical Association, nurses and midwives council, all of them, I think that they have really supported us. And
it's true. Your friend is saying the National Entrepreneurship Innovation Program.
Mr. Darko-Opoku, who names his name? Your friend, Mr. Darko-Opoku. Mr. Busu, phone call and one dear mammy.
And Erica J is Obi. Tell her she's super. No, Mama Fans can be a man.
That be a matron. None can be say NHS for by idea chin or mobile, but still me who is
sweetheart now. Woman is
me who is show.
NEIP. 1 million Ghana cedis be proud class. Someone we say Obi knowing Obobia Darko-Opoku and her passion to humanity. I believe she's the best face to start this great initiative, and I wish her the best and pray she succeeds. Ghana needs to get better on our healthcare issues. Mami Efia Akuto and anyway, I already papa. We wish you well.
Dominic, I think that you have helped us, and we look forward to bigger things.
Sure.
Thank you very much, and enjoy your day.
Same to you.